as you can see from the description and the thumbnail, this is about how to do a head-to-toe assessment. This kind of goes along with the how to give a report video and also my how to give report and report sheet download on my blogging, my nurse blog, megfort.com. So it's gonna kind of fit in and overlap each other just a tiny bit, but I wanna help you just get a head-to-toe assessment in the real world, because we've all heard head-to-toe assessment in nursing school, but it is not realistic, because in the real world, in a 12-hour shift, when you have, depending on your department, 2, 3, up to 6 patients, you don't have time to do an hour assessment on each patient. So you're going to want to do a head-to-toe assessment that is quick, concise, but also focused on why they are there. So, of course, when you go into every room, you're going to want to confirm the patient's name. You're going to want to look at your little sticker or report sheet, and also kind of look at their bracelet like, this is the right patient, right? You're going to want to update your whiteboards. Don't roll your eyes. Update your whiteboards. Put your name, your number, your text number. What I think is helpful is to put the doctors on the whiteboard. So if you're expected to be seen by the GI doctor, the renal guy, the neurologist, put their names up there just so they know who's coming in. You're always going to want to start a conversation with the patient. Introduce yourself. Hey, I'm Meg, I'm your nurse. I'll be here till 7 p.m., whatever you need. And kind of gauge where they are mentally. Really quick, be asking their names, where they are. The date. You can already get like if they're oriented, if they're alert, and what language they speak. Very important. If they are on a monitor, awesome. You're going to be able to see their rhythm. Kind of take note. Did they say they were in AFib? Oh shoot. They said they were normal sinus rhythm. Is this arrhythmia new? So you can check that right away. Also pulmonary. You see what they're breathing. Are they breathing room air? Are they supposed to be on oxygen? Did they just rip off their CPAP mask? Oh shoot. So you're going to want to check that. And then you have your stethoscope right there. So you're going to want to, when you come in, if you're in the morning, you're going to want to switch on the lights, check their pupils real quick, part of neuro, and then just take a quick little listen while they're talking and they're breathing. You can also tell them to take a deep breath while you're asking them certain questions. You can see if there's crackles, wheezing, clear. They're a little absent maybe in some places. So right there you already got pulmonary, you got how they're breathing, what they're breathing, and what their lung sounds are. And then, while you're right there, just move the stethoscope over to the front, listen to their heart. Just got to make sure you got a good lub-dub. Maybe they have a murmur or something like that. Just really quick, listen up. Maybe they have a really cool old valve and you get a little clicking sound. That's always kind of cool and interesting. And then just take a quick look around if they have access, if they have a PICC line, if they have a central line, if they have an IV. Take a peek at it. Hopefully it's dated. Make sure you know what the date is. Maybe it's time to change it. Make a little note of that. Maybe they have some IV fluids running. Make sure it's what the last nurse said was running. Make sure the bag is not like about to be empty. In case you have to go grab that, you can make a little note like, oh, he's going to be done with this normal saline in like an hour. I better get that really quick. And then also checking the access. Hopefully the IV is not infiltrated. Hopefully they haven't pulled out their PICC line. We've all been there. And then you can check any extra devices. Maybe there's a wound vac. Maybe there's a Foley, something like that. Doesn't need to be emptied. You can also take note if they're, continent, that sort of thing. And then activity, if they need to go to the bathroom, how do they walk? Can they get out of bed at all? Maybe there's a lift outside of the room. Maybe there's a walker inside of the room. That's something to kind of just look around the room and be a detective and kind of take note. Also their skin, real quick, just check their skin. If they're a new admit, take more time on this. Trust me. Check their bottom. Check any bony prominences, especially if they're not ambulatory. Check those out.
I love Mama. I love Mama. I love Mama.
Thanks, buddy. But just check it all, make sure they're not diaphoretic, make sure their skin is warm, dry, and intact. If there is a wound from before, you're just gonna want to take a peek at it, check if the dressing is dated, and then if they have any surgical wounds, like maybe they came in for something and they had a procedure, just check those wounds really quick, make sure they're okay. It takes you 2 seconds. And then check the diet, if they're AccuChecks, make sure labs were done, all that sort of thing, and always engage in the patient and tell them what you're doing. You know, let's check out that surgical wound. I want to make sure it's looking okay and not infected. And then as you leave, after your assessment, always kind of tell them like, hey, I'm going to be back in an hour or so. Here's my number if you need something. If you need something simple like a glass of water, another pillow, your breakfast came wrong, you can always call the tech or dietary. Make use of your resources. I mean, there's so many people that can help nurses because the job is crazy difficult. So always make use of your resources. You know, if you are really busy, don't stop to grab a spoon for a patient. Just ask somebody to help you. The secretary at the desk, if she's not or he's not busy, can grab a spoon for the patient. Or the tech can help the patient to the bathroom. Things like that. But also kind of give them a little idea of the plan of care. Not just, I'm your nurse, we're going to hang out for 12 hours. But be clear on, these doctors are going to come and see you. We're going to get more fluids today, more antibiotics. You know, kind of give them a little plan for the day. It also gives them a little bit of peace and that we have a direction for their care. It's really important if you've ever been a patient in the hospital for something wrong. It is so scary. You really want to know everything that's happening and you want to know that there's a plan. You need to know that there is a plan because it is so frightening to be sick and you want to know that you're reaching towards a goal. So if they have tests ordered that day, labs ordered that day, doctors coming, tell them what that is. And that's your really quick head-to-toe assessment. You can do this in less than 10 minutes. And then you can start with your, you know, med preparation, AccuChecks, all that sort of thing, start covering insulins. But you really can do a full head-to-toe assessment in less than 10 minutes. You can do it, especially if you combine tasks. If you are listening and assessing while you're asking the patient questions to make sure they're neurologically there. You can be listening, checking other things while you are checking out their devices, their IV pumps, their Foleys. While you're emptying things or measuring things, you can also be telling the plan of care and all that. A big part of nursing is multitasking, and if you can multitask well and make the patient feel safe and finish your tasks and be a good coworker, you've mastered your shift. You're doing great. Please like this video and subscribe to my channel. I've got a ton more nursing videos already uploaded and a ton more coming. I'd love to hear what you want to see and what you are struggling with as a nurse or what you just want to talk about. Because nursing is hard and we got to talk about it and laugh about it or we will cry about it. Don't forget to check out my nursing blog, megfort.com. I'll have links to all this stuff below. Thank you for watching. If you have any suggestions or tricks and tips as you've done head-to-toe assessments, put them below in the comments. I'd love to talk about them and use them at work. So have a good trip, guys. Bye!